Hello, everyone. Thanks for joining us here at the McMaster Health Forum and online for our latest in our Queen Elizabeth Scholarship webinars and presentations. I will give you just a quick little rundown of the forum and our scholarship program, and then I'll turn it over to our scholar presenters for today. The McMaster Health Forum is a leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders to be an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program here at the McMaster Health Forum is managed by a unique partnership of Universities Canada, the Rita Hall Foundation, and Community Foundations of Canada, as well as the individual Canadian universities that are involved. This program is made possible with financial support from the Government of Canada, provincial governments, and the private sector. The purpose of the overall program is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The forum has had two Queen Elizabeth Scholarship programs. The original program was the Queen Elizabeth Scholarship in Strengthening Health Systems, and we are one of 20 Canadian institutions to be selected for a second Queen Elizabeth Scholarship program, which is now running until the end of 2023. The focus of our current Queen Elizabeth Scholarship Program is Strengthening Health and Social Systems, where our scholars will contribute to strengthening health and social systems and become part of our large and growing network of health and social system leaders. Our original scholarship program engaged 14 incoming scholars and 3 outgoing scholars and 44 outgoing interns. So you see the list of all of them on your screen now. Our current program on Strengthening Health and Social Systems has so far engaged 7 incoming scholars and 13 outgoing interns. There are no outgoing scholars for this version of the QES program. And you'll see a picture there of some of our scholars who were recently at an event at Queen's Park with the former Governor General of Canada and the current Lieutenant Governor of Ontario. Our scholar presenter today is Shraddha. Shraddha was, at the time of her internship, an undergraduate student in the Bachelor of Health Sciences program at McMaster University. Her research interests include workplace equity and inclusion, the extent to which intersectionality is captured within various areas of literature, and the multi-level factors shaping one's well-being. Through her internship, Shraddha hoped to better understand strategies for centering community members' voices in the evaluation of engagement efforts, the structure of India's healthcare system, and health needs within rural India. Shraddha, over to you.
Thanks so much, James. Good morning, everyone. I hope you're having a good day so far. My name is Shraddha, and I will be discussing my 2022 QES experience at the George Institute for Global Health, or TGI, in India. Just to tell you a bit about myself, I graduated with a BHSC from McMaster this past April, and I'm now a first-year Master of Public Health student in health promotion at the Dalalana School of Public Health. So on April 30th, I and my fellow Kiwi scholar Tushar landed in New Delhi. We stayed in India for a total of 90 days, flying back to Toronto on July 29th. Especially given both mine and Tushar's ancestral roots in India, this QES experience was transformative on so many fronts for the both of us. Just to situate us geographically, here is a world map. Toronto, as you can see, is in the top left-hand corner of the map, and we flew to New Delhi, which is the Indian capital and the location of TGI India. To provide a very simplified overview of India's subnational boundaries, officially, there are 28 states and 8 union territories in India. The distinction there is that union territories fall under the national government's jurisdiction, and Delhi happens to be one of the union territories. We were primarily located in New Delhi, which is the capital of both Delhi and India. TGI India is located in southeast New Delhi, which you can see is indicated by the lower arrow on the map. And TGI's office was actually operating on a hybrid basis given the evolving COVID-19 situation within India and internationally. So some days we went into the office, but many days we worked remotely, either from our Airbnb in Southeast New Delhi or a region to which we had traveled elsewhere in India. So let's delve now into the internship itself. The George Institute for Global Health, or TGI, is an international medical research institute. Although its headquarters are located in Australia, TGI has offices and academic affiliations in India, the UK, and China. Given every single country's unique needs, the priority areas vary across TGI offices. So if we go to the next slide, we can see that in India, the priority areas are mental health, neurology, and trauma, evidence synthesis, non-communicable disease research, women's health, bilateral knowledge exchange and capacity building, as well as primary healthcare. And on the slide, you can see a photo that I snapped of the Jasola District Center, which is the location of TGI India's office in Jasola Vihar, which is one of the neighborhoods in New Delhi. Health equity is absolutely central to TGI India's work, and I'm very, very lucky to have supported their Health Equity Action Lab, or HEAL, throughout my internship. Members of the team are very lovingly called healers, and we are led by Devaki Nambiar, who is my direct supervisor throughout the internship. So there is a very vast range of health equity related work that takes place at HEAL. And just a working definition of health equity by Public Health Ontario is that it is created when individuals have the fair opportunity to reach their fullest health potential. I also have a list here of the main projects that I supported. The first one is Community Action for Health, or CAHI, from the National Rural Health Mission to Universal Health Coverage. Secondly, we have SPHERE, which stands for Social Participation for Health, Engagement, Research, and Empowerment. I also supported a scoping review intended to support national governments in developing equitable health policy. And finally, I participated in and facilitated capacity strengthening activities. So central to both CAHI and SPHERE is community or social participation for health. Before I delve into my project specifically, I think it's important for me to share some global context. So very broadly, community voices and actions are absolutely crucial for ensuring that policies are actually responding to community needs, and that no one, especially marginalized communities, is left behind within those policies. This is especially key in the context of the Sustainable Development Goals, including Target 3.8 surrounding universal health coverage. But unfortunately, the extent to which communities are empowered to participate varies across contexts and regions. Within India, social participation in health has been taking place for decades. On the next slide, we can see some of this work. So there have also been moves towards decentralization or sharing power with sub-state levels like districts and villages. Building on this very long history, India launched the National Rural Health Mission, or NRHM, in 2005 to increase the quality, equity, and affordability of rural healthcare. NRHM has 5 pillars, one of which is the communitization and decentralization of healthcare. Since the original NRHM pilot, social participation of health, however, largely hasn't been implemented as it was intended in the original policy. What TGI does is that it supports the documentation, evaluation, and implementation of social participation for health, both in India and internationally. I think we can go to the next slide. So within India, the documentation of social participation for health activities under NRHM, as well as their lessons, has been piecemeal. So through CAHI, TGI India has worked to document the NRHM social participation for health activities using the novel witness seminar methodology. I won't go into too much detail about it now, but essentially the witness seminar brings together key actors who witnessed firsthand a historical event, so in this case, social participation for health as part of NRHM, and then they share their perspectives to create a historical archive of those activities. Before I started my internship, the healers conducted a series of witness seminars. My first task was to help edit those transcripts for clarity and flow in a way that still preserved the witnesses' voices. And once those edits were in, we annotated them and compiled them into reports that are now available publicly on TGI India's website. Under CAHI, I also supported the writing of a related manuscript. The second social participation-related project that I have supported is SPHERE, which is a consortium created in response to global calls for social participation in health. Very broadly, SPHERE aims to help document the experiences of different countries in promoting social participation in health and drawing lessons from that implementation, both for the country level and to advance the broader global agenda around social participation for health. In terms of governance, Sphere has two main bodies. So first we have the Secretariat, which carries out a lot of the administrative and coordinating tasks, as well as the Core Committee, which guides the Secretariat's decisions. And my role has been to co-represent TGI India within the Secretariat. My tasks have been very diverse in nature, but some examples include co-designing branding materials, helping to facilitate and document the meetings of the Core Committee, attend country-specific consultations, help to coordinate between the various organizations, and just in general offer guidance using my knowledge of social participation. The third project that I've supported is a scoping review that informs equitable policy development, especially in health policy. And this scoping review is being led by Tristan Buckley, a PhD candidate based out of TGI, Australia. A scoping review is a method of synthesizing evidence pertaining to a particular topic. It is most helpful and effective when the research question is broad, and the goals of the research are also broad. So for example, to examine the scope of an area of literature or to identify knowledge gaps. Very broadly, our scoping review, which you can see on the next slide, seeks to answer the question of how equity considerations can be meaningfully integrated into various stages of the policy cycle, including but not limited to policy design, implementation, and evaluation. Throughout our scoping review, we adhered to Arksy and O'Malley's 5-stage scoping review framework, which we can see on the next slide. And it's quite prominent in the scoping review realm, so you should be able to find a plethora of resources on this. So on the next slide, we can see some of the tasks that I've been working on as part of the scoping review. Specifically, I've worked on an international team across multiple time zones and learned how to better manage some of those logistical constraints. I've also helped the team to strengthen the scope of our review and the definitions that we're using, and then carry out the different stages of Arksy and O'Malley's framework, including screening, data charting, and co-authoring the scoping review. Throughout my internship, I also engaged in capacity strengthening, so both facilitating it and participating in it. The Shar and I worked with one of our colleagues to develop a capacity strengthening workshop specifically for the use of Covidence, which is an evidence synthesis and review management software. On the next slide, I have displayed the review summary that Covidence compiles for each review. So as you can see, Covidence allows you to conduct all the stages of your evidence synthesis, and it contains features that can help minimize bias throughout the process while also improving the efficiency of the review. The Shar and I also had the privilege of learning from the capacity building activities that were hosted by our colleagues at TGI India. Each week, TGI India hosts an internal research and development meeting where a staff member comes in to present regarding their past, current, or future projects. And through these R&D meetings, I learned about a whole range of topics specific to both India and other countries and internationally. Some of these include the intersections of racism and health, the health of urban waste pickers, women's health, as well as hypertension. My supervisor, Devaki, also facilitated a workshop to familiarize the healers with the Health Equity Assessment Toolkit, or HEAT, which is a software developed by the WHO and other collaborators to help researchers monitor and assess health inequalities using disaggregated data and summary measures. Earlier, I mentioned that TGI was operating on a hybrid model throughout our internships. And although it was definitely said not to maximize time with our colleagues, we did receive the benefit of being able to work from quite literally any place in India. So we had the privilege of traveling to regions outside New Delhi. Specifically, I either alone or with the Shar visited Goa, Gujarat, Karnataka, Orissa, and West Bengal. This was perhaps the most personal aspect of the QES experience for me, because although most of my extended family lives in India, I hadn't really been able to visit them since 2008. And this past summer, through the QES internship, I was able to reconnect with them and spend so much quality time with them, which was an incredibly special process. I also left a big piece of my heart in Delhi. We had the privilege of visiting a whole range of historic sites and monuments. On the slide you can see here is Humayun's tomb, which is the tomb of a former Mughal emperor in India. And other sites included the Lotus Temple, which actually was only a short auto ride away from our Airbnb, and we could see it from our rooftop terrace. We also visited Akshardham, Jantar Mantar, which was historically used by astronomers, and also places like Sindhar Nursery and Connaught Place. I would highly recommend these for anyone who has a chance to travel here. I will mostly allow this slide to speak for itself, but all the foods that I got to try in India brought me so much joy, and I think that the diversity of dishes presented on the slide very much reflect the diversity in India and the fact that there is such a vast range of cultures and perspectives there. And finally, I wanted to end off with some of the travel guidance that I have. I think that the number one learning that I had and something that Bashar and I tried to practice was being very, very intentional in our interactions because we were navigating a new place and we were also reflecting on our identities and how our identities connect with that place. So intentionality was very, very key. We'd also recommend familiarizing yourself with keywords and phrases in the local languages because it will definitely make your life easier in terms of navigating. There are also some other tips like downloading apps for day-to-day living, cell phone guidance, and so on and so forth. But if anyone has any questions, I'm happy to provide that guidance one-on-one as well. And finally, I want to give a huge thank you to McMaster Health Forum, Queen Elizabeth Scholars, and TGI, as well as all the other organizations that made this experience possible. It's really hard to summarize everything that I learned and felt and experienced throughout this internship, but I'm very happy that I got to take some of my theoretical knowledge and community engagement and carry it out more practically, which helped me learn about more considerations for doing community engagement in ethical and inclusive ways. It also helps me to reflect on my identity as a first-generation immigrant, to better understand the dynamics between the different levels of government, especially in the healthcare sector, and finally to reflect on health equity as a concept and to tease out some of its nuances. So that is the end of my presentation. Thank you so much for listening.